Hey, good evening, everyone, and welcome to our Monday Night Live. We're happy that you are able to join us. And as usual, we do have a lot of individuals who do listen to our YouTube recorded presentations, and we're happy when they listen too. I got feedback today from one of our listeners, because of a different time zone, and sharing how much the information has been a blessing to that individual. So we want to give God thanks for gathering us here together. We're starting, and because we have much to cover. Today is actually the 8th week to our wellness program, part 2. And we need to get everything covered in this session. So let's just have a word of prayer. Heavenly Father, we give you thanks for your love, for your mercy, for your grace. We give you thanks for knowledge and information as to how best we can keep our bodies healthy. We thank you for everyone who have joined and coming on shortly and who would listen to today's presentation. We ask that you grant them a rich blessing so that they can enjoy good health. This is our prayer in Jesus' name, amen.
Taking good care of your health is a personal responsibility. To do a good job, it requires knowledge and practice. Join us for 8 weeks to wellness and become a healthier you. Each week, you will get new guidelines and wellness challenges. In the end, you will be on your way to living a healthful lifestyle and enjoying the benefits. So join us, Healthier Me.
All right, and today we are November 18th, and we are on our 8th week. You know, it's amazing that all of those weeks went by so quickly. And now we are here towards the end, and we're going to go do a review. I'm hoping that you're ready to review with us and share, you know, in reflection what our series has been to you. And then next week, we'll have another interesting topic. We want to look at some lifestyle diseases because we're getting a lot of questions coming in on our chat group, asking about what to do for high blood pressure, for diabetes, what to do to reduce, you know, different kinds of situations. So we're going to start looking at those lifestyle disease conditions, and you would see how what we've been covering here so far during the past 8 weeks, how all of that is going to come together. Okay, so kidney issues and whatever different topics would come on as time progresses. So let Dr. Natalie Nash, and I'm from the Pure Wellness Lifestyle Center located in Trinidad of the country, Trinidad and Tobago. And here at our center, we interact with a lot of individuals and help them in recovery of their health. And even they can come and have an experience and live in and spend some time where they can learn how to take care of their bodies better. So Healthier Me, it's a step-by-step approach to improving my health in 8 weeks. And by God's grace, you have been improved over the past couple of weeks. And as we usually say, that health is a journey. And every day you will practice some aspect of health. And that's what we want to encourage, a culture of practicing wellness, where what you do, what you eat, what you drink, what you know, that it's all towards promoting a healthier body, as opposed to contributing to breaking down that body. You know, sometimes you may see certain snacks and it's like, what's that? You know, it's more chemicals than anything. It's not flour, it's not potato, you know, what's that? And there's some snacks, it's all like sugar and different chemical preservatives, coloring, everything put together. So we got to be careful about what we put in if we want to get good results out. So along life's journey and along your journey to in health, you may be somewhere along this path, and hopefully you're getting closer towards the level 4 and 5, where you're reaching your health goals and you're already there and maintaining a healthy diet and weight and lifestyle. But no matter where you are in your journey, we're all on this together. And even if you go up and you slip down, you know, like snakes and ladders, you can come up again. And we just want to encourage you every day. Don't stay down. When you fall down, you rise up. You know, there's a song that says that. So during our 8 weeks, what have we been doing? Number 1, week 1, developing a healthy lifestyle, and where we talk to you about, you know, connecting with someone, having a health buddy, a friend that you can share with and do the wellness together. Week 2, we covered becoming a more physically active you and talking about sedentary lifestyle and the benefits of being physically active movement. Week 3, we talked about choosing healthy fats. Week 4, looking at healthy and choosing healthy carbohydrates. Week 5, maintaining a healthy weight. Week 6, enhancing mind-body connection. And week 7, 14 ways to beat stress. And week 8, getting preventative health checks. And this is part 2 of week 8. So let's look at what we, in terms of getting preventative health checks. Last week, we covered, you know, things like your high blood pressure, high cholesterol levels, and sugar, high glucose levels. And what are some of those numbers that we need to be aware of? So if you have not yet looked at week 8, part 1, please have a look on our YouTube channel. The YouTube channel is under my name, Dr. Natalie Nash. Okay, so that's that. So week 8, some more preventative checks. So apart from the blood sugar, the blood pressure, and looking at your cholesterol levels, cancer is very much another one that we should be screening for. And you'd find that cancer may be prevalent in certain families, but it's prevalent in our society. Right now, almost every week, not almost, definitely every week, there's some new person to talk to with cancer. And sometimes in a week, it's multiple. And it is one that, you know, it's quite rampant and individuals are pretty much advanced in their state. But these are some basic ones where we can be screening for. The screening test for colorectal cancer, breast cancer, cervical cancer, and prostate cancer. When it, okay, good. Hello, Sister Ramin. Welcome. My name is Princess. Very well. Hello, Sister Princess. Okay, so colorectal cancer, it's the second highest death rate of all cancers. Okay, the second highest, colorectal, and up to 90% of colorectal cancer deaths are preventable. They are preventable. And what is that? Is your colon or cancer in your colon or your rectal area. So it's sort of like together, looking at the cancer anywhere along your colon. It is said that 90% of them, they are preventable. So why is it so prevalent? In any event, adults, when you're over 50 years, or sometimes earlier, depending on the family history, if there's a history of parents having colorectal cancer, then you find that the children may be screened earlier than 50 years. But ideally, when individuals get to 50, you'd find that you'd be encouraged to do a stool test, checking the fecal matter for any blood in there as to see what's going on. And if there's a find, then they would do some further testing. A colonoscopy more for individuals in the senior years, and then all in the 50s, yes, but you'd find colonoscopy may be recommended depending on the diet, the lifestyle, any issues of concern, and or if there's some speculation based on the stool test. There are other tests that may be recommended by your doctor depending on what your complaints might be. And you would also need to check your physician if you experience any abdominal discomfort. And that is what we would encourage, that you check your physician. You keep having abdominal issues, diarrhea, consistently, pain in the abdomen, and it might be a dull, achy pain, or it might be sharp pains on one side of your abdomen. So you're not sure until you have a look, and it is important to have a look and get whatever finding early. Many times individuals are scared. They don't want to do this. They don't want to know, but it's better to know if there is something wrong with you, and then you handle it early detection. And that's why the deaths can be preventable if there's early detection. I want to also just highlight colorectal cancer. One, inactivity can lead to this. So we did talk about being physically active. So if you are physically active for all cancers, you can help to delay the onset of that. Just keep moving, lifestyle diseases, you keep moving and you'll be better off. Having regular bowel movements is important. And there are times in individuals that don't have good bowel movements. Even if they pass stool, it is not a healthy output based on your input. What you're eating, you're not putting out all of that waste matter. And therefore, you find that what you're putting out, it's hard and dry, and that is so unhealthy. What's remaining? So here's a little tip. In the morning, if you're not yet doing this, I encourage you to do it. And the best time for elimination is early morning. So tonight when you finish, 10 o'clock is coming, you plan to go to sleep before 10. Go in your bed before 10. So by 10, you're sleeping. Getting good rest during the night helps to improve your cleansing of the body. It helps to improve the movement of waste matter in and around the body, in your bloodstream, as well as in your colon. And so you go to sleep, get a good night's rest, and then in the morning when you wake up, go to the kitchen nice and early and mix your water in a glass. You have your room temperature water, and you have some hot water. When you get the pot going or the kettle hot water, and you mix that together in a glass, and you put your little finger, you say, yes, it feels nice and hot. It's not scalding and burning. You take a little sip. Yeah, I can drink this. And then you drink that water. 1 cup, you drink it down. Then you do it again to make another cup. And you put it there, 1 cup, and you drink it down. And then you set up another cup, and you get it hot and nice again, and you start drinking. You might be like going halfway, 1/4 way, then halfway, then 3/4, and you're done. I want you to drink anywhere like 3 to 4 cups of hot water early morning. Okay, this is early in the morning. So you may be in the kitchen, start, organizing your breakfast and so forth. But while you're there, just drink this water down. You may need to go and spend some time in the Word of God to read His Word. Take the glass with you, to measure the amounts. And while you're sitting and you're reading, you're drinking. But get it down and get it down, relatively quick, because it's like drinking as a bolus. What is that going to do? The heat is going to expand your colon. The water is going to lubricate your stool. And the amount of water that you're drinking at that time is going to put a pressure on your colon to excrete it. And you will have an excellent, most perfect, most enjoyable bowel movement. And that's going to help you to prevent certain things like colorectal cancers. All right, so one of the things too is to avoid eating late into the evening. After 6:30 p.m., do not eat. Even if you had to because of what happened during the day, you missed your meals, but it must not be a norm at all. Because when it's a norm, you find food can remain along your digestive tract and you're gonna sleep. And when you're sleeping and that remains, it sours, it rots, and it's along that nice digestive tract, and it can create things like polyps and growths, and that can lead to cancer. So you want to make sure you eat your food before 6:30 at night, and don't let it be a habit for you to eat and then go sleep and you have food undigested in your system. Next, you get your good night rest, and early morning, go for that 3 to 4 cups of very warm, more like hotish. You can feel the warmth going down your chest, and it's going to be beneficial to you to help to get a good bowel movement. Exercising every day, walking every day can help to prevent colorectal cancer. Study shows that individuals who were more physically active, that they had a reduced risk, but it must be combined with a good, healthy, plant-based diet, all right, not on its own. And therefore, let's seek to do well, let's seek to practice wellness. So that's a little homework. If you've not yet started drinking that hot water in mornings, then please do. Individuals can also add about 1 to 2 tablespoons of lemon juice in one of those cups of water for the morning. And then you take a straw and you drink to drink and that lemon water. The lemon tends to stimulate the colon for movement, and that's good. If you want to lose weight, lemon water can help you to lose weight. It's great vitamin C. It helps to increase your immune system and ward off colds and flu. But if you're thinking you don't want to lose any more weight, then just simply do the warm water and you'd be fine. Okay. So the next cancer to screen for will be breast cancer. It's the second leading cause of death from cancer for women. And having a monthly self-examination is important, where you literally, feel that breast and you go around in a circular motion and feel to see any lumps anywhere. Okay, all under here, under the arm as well. Press and feel any lumps, any lymph nodes that's hurting. And if none, then fine. But if you do feel anything, please have it checked as soon as possible to see what's going on with that particular lump. Now, it's recommended that women have an annual checkup for their breasts examination, especially if they're over 40 years or earlier, if there's a family history for breast cancer. So mammograms or breast ultrasounds may be recommended for you. Most times they go for the mammograms, very painful, and women don't like that. But the mammogram shows up different, images as compared to the ultrasound. But have a conversation with your healthcare provider and see what may be best for you. And usually I would like to go for a breast ultrasound instead than a mammogram. That's squishy painful. Now, as a doctor, specific guidelines based on any issues that you may have, so there are a whole lot of things to consider. But have your breast examined and take care of them. And you take care of your breast as you pay attention to any lumps, or even sometimes some women may have dense breasts, so you can just make sure like you can rub castor oil at night. And if you rub castor oil, then that helps to keep everything nice and flowing. Make sure that you're not using antiperspirants that prevents your underarm from perspiring, because under your arm you have lymph nodes, you have some little openings of pores that can release any toxic waste matter that's connected to your breast. So if under your arm you perspire, then it will help to take care of any of that. Okay, so oh no, somebody's writing up in the screen. Yeah, so another thing is to avoid drinking of tea, caffeinated tea. Avoid drinking coffee, cocoa, chocolate teas, or eating chocolates. Those things tend to promote fibrocystic breast lumps, cysts in the breast, and because of the caffeine in it. So you want to avoid those items. So that's a little pointer and a tip. And of course, having a total plant diet, as we have discussed and will continue to share with you. Okay, another examination is that for cervical cancer. This can also be preventable. Now, if you're sexually active or older than 21 years, you should have a pap test every 1 to 3 years. You may not be sexually active, but yet that still doesn't prevent you or limit you for having a pap test, a pap smear test. So it's recommended for our women just to check the cells of the cervical area and make sure that they're healthy, that you have no abnormal cells. If everything is good after a year, you do it once, then the following year you do it and you have good results, then you may not have to do it for the next 3 years. Okay, and once you keep healthy, be in a monogamous relationship. That's the safest way to prevent cervical cancer or abstinence. So women who have multiple partners are more at risk for getting cervical cancer. Is once you have that intimate relationship with each other, you find that certain bacteria or germs or viruses may pass on to a party, and then you now come and you are engaged with an individual who have been previously exposed, and you find that you can pick up sexually transmitted diseases or certain agents that can make your cervical cells go wrong. And that I've seen, and there is a connection with cervical cancer and multiple partners, maybe not just at the moment that you have multiple partners at this time, but over the course of your life that you have had multiple partners. So it's again, having the early detection is really helpful. And if you feel any discomfort, you find that some of our women, they may be through menopause, and then later in their years, like almost 70, 80 years, and they find that they have, one day they just see that they're passing blood through the vaginal area, and it's like, what's this? And I've done, with my menstrual cycle, that you need to go and have a checkup with a a gynecologist as soon as possible, ASAP. Don't delay, because it's an indicator that something has gone wrong and you need to find out what it is. And sometimes it is cervical cancer. And it doesn't, you don't feel any discomfort or anything until one day you're passing blood. So just watch, be careful, do your pap smears and have your checks. All right, so question, what is a pap smear? Pap smear, also known as a pap test or cytology, is a screening procedure that collects cells from the cervix to detect abnormal changes that could indicate cervical cancer or precancerous conditions. So it may not yet be full-blown cancer, but they're sort of precancerous cells, and you can do certain things to avoid it. For example, eating cooked cabbage can help to prevent these precancerous cells from turning cancerous anywhere in your body. So cooked cabbage, broccoli, cauliflower, let's try to eat those things at least 3 times a week, at least. Have a dish with cabbage, next day with cauliflower, kale, Brussels sprouts, broccoli, any of those, have it. So that's why you see when you're eating your food, it's going to be helpful and to keep you healthy. Prostate cancer. It's the second leading cause of death in men. Early detection is helpful. Men aged 40 and above should test their PSA level. And men aged 50 and above should be screened for prostate cancer. And therefore, if you're at the right age, have your test done and discuss the test with your doctor to find out what if there are any issues, what would be the recommended course of action for you. So it's something, a lot of men don't like to do this test. It might be that digital rectal examination using a finger inserted into the rectum to feel for the prostate gland if it is enlarged. And that one is not pleasant. However, you do have blood tests that can show your PSA level as well. So whichever way you choose, do go have a checkup. Once you're 40, that's a birthday gift to yourself to make sure that you're taking care of you. Okay, and so those are what we look for with the cancers. Just 1 second. All right, so there we go. Okay, so osteoporosis. 1 in every 2 adults over the age of 50 may be at risk for breaking bones due to low bone density. So if you have your bone density, it's quite reduced, and a lot of age individuals can break. They can have falls, hip fractures, and the list goes on. So what you need to do is that once you're over 65 years old, you should get a bone density test. Test earlier if you're prone to falls, if you smoke, or if you have a sedentary lifestyle, or you are overweight. Bone density. So one of the things that we can do is you may think, well, if my bones are not strong, what can I take for my bones to be strong? That's a typical question. What can I take? You can take some calcium, right? That makes sense. But let's start off with what can you do? How about some walking? When you walk, you increase the absorption of calcium in your body, When you walk, you find that it helps to put some pressure and stress and demand on your bone to be strong. So what can you do to maintain bone density? Especially as you get older, you need to start walking. You may not be overweight, but you need to keep fit and to prevent disease, so you still walk. Individuals who are overweight need to lose that weight because you're putting a lot of pressure on those bones, but you still need to walk. So eating a calcium-rich food and rich diet coming from your green leafy vegetables, and that can work nicely for you. So your spinach, your chard, arugula, all of those green leafy veg. And then sesame seed. It's high in calcium and it works. And there's some small little seeds. You may find them in your supermarket. And all you do every day, just eat 2 tablespoons of sesame seeds. You can put it straight to your mouth and chew it up. You can mix it in a little almond butter and eat it. Or you can put it over your peas and your beans and just eat it with your food. Another thing to get will be vitamin D to ensure you have good vitamin D level through getting adequate amount of sunlight every day. And however, if you're quite deficient, you may need to supplement with vitamin D3, and that can help to improve the absorption of calcium from your food into your body to give you strong bones. And once you have strong bones, you have strong teeth. Yeah, because sometimes teeth fall out because of low calcium levels. So let's seek to have optimal amount of vitamin D. Engage in weight-bearing exercises. So walking, yes, but just getting some weights, little weights that feels heavy enough for you. Not overly heavy, but heavy enough for you. And that, as you lift your weights, it's going to help to strengthen the bones. What are we going to screen for next? Sexually transmitted diseases. You know, it's so unfortunate that in a situation where there can be so much joy and passion and excitement in life, it can also come with a dark side of it. And that is sexually transmitted diseases like HIV, gonorrhea, syphilis, just to name a few. And if you are sexually active, talk to your doctor to see whether you should be screened for any of these. For complete protection from STDs would be abstinence. Just not having sexual intercourse could keep you away from getting a condition that can be transmitted through sexual intercourse. So having a monogamous relationship that's mutual on both sides. And if both sides and parties have no prior exposures, if they are clean, and then you meet and you remain, faithful to each other, then you could be safe. But at the same time, abstinence or condoms may be an option for you. So have a discussion with your doctor. Seek to have screening early in your relationship, and even before getting married, screen both sides. Go together and take your test. You find that might be a tough decision to make, but it needs to be made. At least you can go into that union with your eyes open, with a knowledge of what your risks are, as opposed to going into it and not knowing, but it doesn't change anything. If there is a risk or there is a disease to be passed on and contracted, that doesn't change. It's just that you have knowledge of it. And you can take precautions. So go do your test together. It takes guts, but it's needed, it's necessary, it's helpful. You're gonna, be happy you did in the long run. And that can help to save a lot. Okay, when these conditions are in the body, it stays within the body. HIV, gonorrhea, syphilis, it stays, the virus stays in the body. It doesn't just go away like a flu. And so it's important for you to know what's happening. Another screening examination can be that for hearing and vision. You find that these are required annually, especially as you're aged, to check your hearing as well. And especially if individuals say to you, your family members or your spouse say to you that you don't hear very well, then believe them. Believe them when they say so, and go and have a test done to prove them wrong if that's the case, if you think that they're wrong. But go and have a check. Now, when it comes to the eyes, the ages between 40 years to 64 can get checked every 2 to 4 years for glaucoma and cataracts. And so if you check your eyes, do I ask for a little further examination? Do I have cataract? Do I have any signs of glaucoma coming? Then you can take caution. Of course, a total plant diet supports the prevention of this. For glaucoma, just maintaining a good, healthy blood pressure, as opposed to having high blood pressure, puts you more at risk for getting glaucoma issues. And cataract, consuming dairy, animal milk, and their byproducts can increase your risk for cataracts. Another screening examination is the dentist, the dental exam. Visit the dentist at least once a year. Preferably have your teeth cleaned by a dental hygienist every 6 months. And then you can clean them. And when you do, you find that it keeps your teeth in your mouth for longer. There are individuals who have unhealthy teeth and unhealthy gums, where their gums may bleed because of periodontal disease. You find that the teeth may loosen from the gum and shake, and it's an inflammation in the mouth. Therefore, by having your regular checkups and following the advice of your dental hygienist can help you to preserve and keep your teeth. And so eating plant foods, healthy plant foods, where you have your green leafy again to get calcium so that your enamel is strong, and having low inflammatory diets that would reduce acidity so your enamel remains strong. What about sweets? Let's avoid having sweet and popcorn. Now, a lot of times when individuals snack in between meal, that's a big problem in many ways. And one way is that you're putting food in your mouth that's largely sugar. And that's going to hang around there. You're not going to brush your teeth after eating a snack. Who does that? Rarely, right? Folks may brush their teeth after eating a meal, but not after eating a snack. So if you eat sweets, that sugar is going to remain on your teeth and start eating away at your enamel. And if you had any healthy sweet item, it's best to have it at your mealtime. Now, popcorn tends to stick all in between the teeth in the grooves, especially when you have your wisdom teeth. You may have some gum folds there that can trap food, and popcorn is one of those foods that remains trapped in your mouth. Sometimes you brush your teeth and then hours later you're passing your tongue and you're feeling something, and when you look, it's a piece of popcorn. It never left your mouth. So watch the popcorn. It's not one of those items on the top dental list when it comes to permissible foods for eating. It's really way down the list. They don't like, because sometimes when you go to clean, they're pulling out popcorn from in between your teeth. It's important every day. It's important when every night to flush and brush and floss your teeth. And in that way, you'd prevent tooth decay. And you'd keep, when you floss, you also keep your gums healthy. Sometimes the gums are not getting cleaned, and you find that food bacteria remains on the gum itself, and that can wear down the gum. So if you floss your teeth, what dentists will usually say, floss the ones you want to keep. Okay, so those which you want to keep, you want to floss them. Hopefully that's all that you're going to have. So finally, let's seek to practice safety. So this is another, we talked about screening for so many things, but here you have some responsibility now to practice safety. Always wear seatbelts. And if you're in a vehicle and you're not wearing seatbelt, that is an unsafe practice. And that can put you at risk for being thrown out of the vehicle in an accident, for being tossed around to and fro in any emergency. So wear a helmet when riding or for your appropriate sport. If your sport requires a helmet, wear them. A lot of head injuries can take place when individuals engage in sport activity and do not wear a helmet and you have contact. And playing ball may require you wearing a helmet, because the ball can hit your head so hard and cause injury, head injury, that can lead to loss of hearing, speech difficulties, coordination issues, you name it. So helmets. And next is to install smoke detectors near all sleeping areas in your home. That is practicing safety. If you have smoke detectors and it's close to your bedroom area, while you sleep, you can be alarmed if there's some smoke for you to attend to. And because you don't know, and a lot of folks lose their lives or have respiratory issues from inhaling smoke. We want to detect it early. Another advice will be never drink and drive, or after taking certain prescription drugs that might make you drowsy. That's risky. Then take your time to move around and prevent falls, trips, and slips. Especially if you go to a new environment, you're not familiar with the terrain, and you're watching every step, how you put your foot, where you put your foot, and that can keep you from falling. As you get older, you tend to be more prone and at risk for falls. So I just think that might happen. So you want to prevent it. And be careful, watch where you're placing your feet. Sometimes you're hustling in a public transport, in an airplane, at the airport. All that's new areas for you. So watch your steps. Hold on to handrails when ascending and descending stairs. A lot of folks like to just get on a staircase and trip, 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 trip. They're bouncing down the steps. That is an unsafe practice. Don't do that. Hold the handrails as you come down. That helps so much to prevent you, if you tripped, that you wouldn't fall all the way down and hurt yourself. You'd be able to grab on those bars and protect injuring yourself. So hold the handrails when you're going up, when you're coming down, making sure your hands, at least one hand is always free to hold those handrails. Okay, so here we have our weekly goals. And what do you do this week? Schedule an annual checkup with my doctor. Make an appointment to test my vision. If you have not done this yet, especially we're at the end of the year, then do that. Practice safe sex, abstinence, monogamy, or condom use. make an appointment with my dentist. Participate in a local health fair. A lot of times health fairs are available. Go to it, participate in it, get some of these blood work or screening tests done. Hearing, vision, maybe, it might be cholesterol, high blood pressure. There are individuals who did not know anything was going on with them until they attended a health fair and had some tests done. And then they saw a need for concern. Wear your seat belt when in a moving vehicle, or even a helmet for any appropriate sport. Replace the batteries in my smoke detectors. That's important. Don't think, well, the batteries are through, I need to replace them, and you take the detector off. Put them back on, seek to make it a priority to replace them. And never drink and drive. That's super risky. And at the end, have fun being a healthier me. I hope this can be your achievable goals during this week. I want to encourage you, if you have not yet done any of these screening tests that we've mentioned, that you make an effort to go to your doctor this week and schedule an appointment, make an appointment, and do them. It is your life. It is your responsibility for health. So we will have your preventative care. So you just check the box, put on your points, 3 points, if you're brushing and flossing every day. And so this would be shared with you in the chat. We have a fruit muffin, and here's the recipe. It's calling for 3 cups of whole wheat pastry flour, and 1 teaspoon of salt. If you don't have pastry flour, you can use cornmeal as an option. That can work. And then the wet ingredients, you're going to have 1 1/3 cups of whole blueberries or other fruit cut into small pieces. So you can have pineapple, cranberries, cut up the fruit. 3/4 cups of cashew cream. You want to blend that in water to get 3/4 cups of nice creamy cashew nuts. And 1/2 cup of applesauce, 1/4 cup of apple juice concentrate, 1/4 cup of maple syrup, and 2 tablespoons of water. You want to mix the dry ingredients together, the flour and the salt, and then add the wet ingredients in a separate bowl, and then you combine, throw the wet ingredient over and stir briefly and quickly. And if the batter seems too dry or thick, just add some more almond milk or apple juice as needed. And then you spray your muffin pans, or you can get parchment paper or those paper cup things for baking, and you fill the ingredients in there, and you're baking at 325 degrees Fahrenheit for 35 to 40 minutes or until golden brown. You just stick a knife or a toothpick and see if that comes out clean, and it can give you a nice fruit muffin. So quite easy to put together. And even if you don't have apple juice, applesauce, simply using your sweetener, you may need to add more water because all of this would be liquid, but add some more water and that can be fine. All right, so then, okay, so we have just 1 or 2 minutes as a review. At the beginning of our session, remember we posted this up. How do you feel today? Have you lost any weight over the past 8 weeks? What about your physical activity? Have you been more active? If you smoke, have you considered stopping smoking, or was a champion at it and quit smoking? What about your red meat intake? How often do you now never have it or have it less times per week? What about your whole grains, and how many servings of whole grains do you have? like brown rice, for example, oatmeal. Brown rice, it's really filling because there's a layer of fiber in it. And when you eat it, it can help you to feel fuller for longer and have better energy, have more energy, because if you're satisfied with your food intake, you're not famished, you're not hungry. Like for me, if I were somewhere and I ate white rice for about 2 or 3 days, I begin to feel hungry. I mean, like by the day one or the second day, I'm really starved. So I'm a brown rice person, wild rice, red rice, a whole grain rice. Then fruits and vegetables, we encourage that you had more servings of fruit and vegetable. Hope it's going up the scale to be like 5 to 9 servings daily. Like, let me see, over the weekend, it was this last weekend, and I think I did it this weekend too. In the morning, I just had a breakfast of fruits, only fruits, but enough so that I was filled and satisfied. So you can do many things. You can have like 2 apples, 2 bananas, a bowl of papaya, and cucumber, like a whole cucumber. And if you eat something like that, it's all raw, fiber is in there. You can also have pineapples. There's so many raw foods that you can eat, fruits that you can eat. And then end off with a handful of nuts and seeds. And when you do that, you'll have great energy. You'll be full, but you don't have so much energy because your body isn't focused on digesting a heavy cooked meal. And just simply raw. There you find it so easy to get your 5 servings of fruit. Sometimes in your breakfast alone, you can have your 5 servings of fruit. Sometimes I may have, let me see, like 1, 2, 3. Yep. Say like this morning, I had like about 4 servings of fruit. And then I had my brown rice, my black-eyed peas, and yeah, I think that was it. And then I had my nuts and seeds to end. That was it. Okay, so you can do that. On other times I might have had pumpkin or something else. So, but if you did that, you can have, and the food items don't need to be all raw. They can be, you can count in your cooked as well. So having a nice big plate of lettuce, and then your broccoli, carrots, different items on the plate, and that would help to come up for your vegetable intake. Nuts and seeds, you're looking for a closed handful at the end of your meal. Hope you're doing that every day with your breakfast and your lunch meals. And happiness, seek to remain happy, always happy and satisfied. That's what we want to aim at. And sleeping, that you're getting at least 7 hours and more of sleep. Individuals who get less than 6 or less hours at night, they put themselves at risk for many of these lifestyle diseases, including cancer. So you want to have anywhere like 7 to 9 hours of sleep. 9 hours of sleep is perfect and excellent. And then having social support around you with family members, all of that is very important for optimal health. What is your blood pressure? Is it elevated? Then we need to work on getting that into the normal range again. What is your glucose, your blood cholesterol? Is it elevated over, look at total cholesterol, over 240 or between 200 to 239, that's elevated. We want to see it less than 200, even closer to 150. Your LDL, we want to see it less than 130, even closer to 100. So depending on where you are on your scale at the start of our 8 weeks, hopefully by the end, now you have improved. All right. So as we wrap up here, if hope you're having fun with your health buddy and continue to keep that going. Continue to attend our weekly meetings. We've only just begun. Set a foundation, but we're going to build on it in terms of looking at specific disease conditions and other issues. And do the appointed task as we give you goals each week. Practice wellness. Just always ask yourself, is it what I'm eating, what I'm doing, promoting health and wellness in my life? You would know. You're the one that would feel the joys and the benefits. So let's seek to practice that. And then decide on your personal goal to work on and get a notebook. Keep track of your numbers. If you're hypertensive and you're measuring your blood pressure, always keep that numbers morning and evening and make health your top priority. Be persistent. One of the things, don't just start off well and then fall by the wayside. And if you do, then get back on track, take up again and come back up. Be just persistence. It's going to help you to achieve your goal. You want to lose weight, you got to be working at it. Being persistent, even when you don't feel to, that's the time we need to practice wellness. And then have fun becoming a healthier you. So may God richly bless you as we put into practice many of these things. All right, do we have anyone here on the set where you would like to share with us any experience that you might have had over the past 8 weeks as we discussed some of these issues? Now is the time and opportunity. Have you put into action something that you were not doing before and seen the benefit? Okay, I think Ms. Ermin, you're trying to raise your hand, or you want to unmute yourself and share something with us? Okay. All right. So if not, then at this time, yes, anyone?
Good night, Dr. Nash and everybody.
Hi.
Hi, this is Wayne.
How are you?
Oh, I'm blessed and I'm highly favored. I'm great. I'm doing really great. I can share because I continue with my diet, with my exercise, and with everything else, and I'm doing great, thank God, much better than I was. And the truth of the matter, I have not missed anything that I was accustomed to before.
Oh,
So, and yes, I'm having my fruits. I think I have 4 servings of fruits this morning with very little. And you said something, Dr. Nash, and like last week, Thursday and Friday, I did not feel like eating. So I just had some fruits. And strange enough, after the fruits, I had some peas. So it was some yellow lentil and some nuts and seeds. And that kept me until lunchtime. I was not even hungry. I said, "Hey, what's going on with me?" You
yeah.
know. But I am so thankful and I'm grateful for the experience, and I'm really trying. I'm pushing to continue in eating healthy. And yes, I've shed a little weight, thank God. And
Wonderful.
by the grace of God, I promise to continue. And this is for my health and for my well-being. So thank you so much for the program. I got home very late. uh, because I had some good news. My mother at 97 surrendered her all to Jesus and was baptized last Sabbath.
Wow.
Not yesterday, the week before.
Right.
So sometimes I spend some time in the evening before I get home. So by the time I get home, when I get home, the program finish. But
Okay.
glory, hallelujah to God be the glory, and I must encourage you to continue doing the great work in helping mankind. You are truly blessed. My regards to you and family and the entire family at the Wellness Center.
Okay, wonderful. Thank you so much for sharing with us and being also an inspiration and encouragement to all those who are within your listening and hearing. And folks, Sister Weena, she did attend the Lifestyle Center and was able to practice wellness with us while she was here. And the Lord has truly been blessing and keeping her so that she has been able to be on that continued journey to achieving her health goals. And we look forward to hearing more of her story. Wonderful. So thank you. And for all of those who have joined here today, we will be meeting at our next session next week, Monday, and we will advertise and post up our topic for then. If you have not yet joined our WhatsApp group and you would like to, then we would say, I'm going to put it in the chat and you'll have an opportunity if you're on your phone just to click on this and it would take you to that group. But if you're in another group with me and you get the notices, that's fine as well. Okay, so let's have a word of prayer as we close. Heavenly Father, we give you thanks for the session today, and we thank you for your love, for your extended mercies and grace, and even encouraging us all to choose the healthier path to live. It can be a challenge every day, but as we be persistent, we will be able to get there. And we thank you for the victories that you've given many who have not been able to share this evening. And as we live healthier, that others would be so inspired to do the same. Be with us now during the remaining part of this evening. This is our prayer in Jesus' name. Amen. Thank you, everyone, and good evening.
Bye, everyone.